Well, kia ora koutou katoa. Welcome to this afternoon's briefing. There are 3 new cases of COVID-19 to report in managed isolation facilities in New Zealand today, 1 in Rotorua and 2 in Christchurch. And the one in Rotorua I think was quite well known yesterday. It's the same one. Once again, there is no community transmission in New Zealand. The first case we're reporting today is a woman in her 30s who arrived in New Zealand on 20 June, originating in Peru. She has been staying at the Ibis Hotel in Rotorua since arriving in New Zealand and tested positive for COVID-19 following routine testing around day 3 of her managed isolation. Everyone who was on that bus from Auckland Airport to the Ibis Hotel is of course being followed up. All the passengers are already in managed isolation in Rotorua, and the driver, who was wearing PPE, has also been followed up as a potential contact, isolated and will be tested. The second case we're reporting today is a man in his 70s who arrived in New Zealand from New Delhi, India on 20 June. He has been staying at the Commodore Airport Hotel in Christchurch. The man tested positive for COVID-19 as part of routine testing, day 3 of managed isolation. The third case we are reporting today is a man in his 30s who also arrived in New Zealand on 20 June from Ardhanpur in India on that flight out of New Delhi. He's been staying at the Commodore in Christchurch and also tested positive as part of that day 3 routine testing in managed isolation. Now, of course, any possible contacts of these 2 cases are being identified and followed up appropriately. Now, those needing to be quarantined in Christchurch, you'll recall in Auckland we have the Jet Park Hotel as a dedicated quarantine facility. In Christchurch, there is a quarantine section within one of the managed isolation facilities, so those 2 cases in Christchurch will be transferred and managed there for the rest of their stay. It's been previously assessed as a dual-use facility, one indeed that has an area set aside for that higher level of clinical care that someone with COVID-19 may require. Similar arrangements are being investigated in Rotorua, and in the meantime, the case that is currently in Rotorua is being transferred to the Jet Park Hotel to be looked after there. So our total number of confirmed cases of COVID-19 is now 1,169. This is the number we report to the World Health Organization. Yesterday our laboratories completed another new record number of tests, 10,436, bringing our total number of tests to date to 368,432. An update on a revised case definition and our testing strategy, and I've been talking about the shift in the approach to testing over the last few days. I've talked about that. So yesterday evening we released an updated case definition alongside our updated approach to testing. First, on the case definition. So the case definition is essentially a classification of people with symptoms that might be suggestive of COVID-19 to help the clinicians to decide whether or not they need to be in isolation, self-isolation, while awaiting the result of the test, and whether the medical officer of health needs to be informed because they're at potentially a higher risk of actually having COVID-19. And there are certain factors that are considered in assessing that potential higher risk than others who are just in the community. And these factors are whether they've had respiratory symptoms and they have had one of the following in the last 14 days. That includes contact with a confirmed or probable case, international travel, although as we know, those people will actually be in managed isolation, direct contact with someone who has travelled overseas recently or come in from overseas, a history of working on an international aircraft or shipping vessel, and may be involved in cleaning at an international airport or maritime port or areas that may be frequently used by international visitors. So alongside that revised case definition, which again is for our health professionals to assist with their clinical management, alongside this is the updated approach to testing. And as I've said over the last few days, we've now got a much bigger focus on the border with the introduction of the mandatory testing for those in managed isolation, as well as surveillance testing around the border, including people working in those managed isolation facilities, people working around the ports or airports, and also some aircrew if they're coming from high-risk areas. So in addition to that, testing will continue in the community, and we can see, of course, with the high number of tests done yesterday, that which accounts for most of those tests done yesterday. And we will continue that testing as we have over the last weeks and months for people with respiratory symptoms, and they should continue, as has been the advice, to seek advice on getting a test. And as has been the case right since the start of our testing, clinical judgment of the clinician will apply, and rightly will be applied as to whether someone does or doesn't need a test, depending on the exact nature of their symptoms. So just the testing strategy again, in summary, the addition of that quite extensive testing at or around the border and ongoing community testing, with a focus and particular high level of alert around people who may have additional high-risk factors around them. And so, arrivals at Auckland Airport. I've talked over the last day or two about the challenges, as you will be aware, of getting good data on individuals in managed isolation and being able to match that with laboratory results. I'm really pleased to say our team's worked very hard over the last couple of days with the DHBs in Auckland, and since a flight that came in 11 o'clock last night, we've had someone at the border working with customs to get the information on passenger arrivals and make that linkage with people on the NHI database, so that we have that, so that by the time they leave the airport, we either have their NHI identified and we are able to therefore link them to other health databases, or if they don't have one, for example, they've been living overseas for some time, then we can work with the local DHBs to generate an NHI within a day or two. So I'm really pleased that our team has been able to put that process in place. At the moment, it's quite a manual place and has got someone, a manual process, and has got someone from the airport, from the DHB out at the airport, and we are working with customs and aviation security to be able to get a data feed of those people who, when the door is closed on an aircraft and once it's landed, those people who've landed, and we can start to make that match automatically through our data system. So I do want to thank the team up in Auckland and the Metro DHBs there who have worked really hard to get this in place so quickly. And finally, an update on the numbers I provided yesterday. In terms of compassionate exemptions, we have 2 people still awaiting results of tests, and we continue to work with enforcement services to follow up 1 person. I'm not going to talk too much, I'm not going to say anything more about that particular person, except to say I'm aware of the circumstances and it presents a very low risk, but our team are working on that one still. So 40 have returned negative results, and as I said yesterday, 11 who are not being tested for a range of reasons. On the 2 cases that came from the UK and that were identified on the 16th, of the guests who were at the Novotel between the 6th and the 13th of June, which is the period that those 2 women were at the Novotel, there are 5 who are still outstanding of 190, and they continue to be followed up by finding services, and all staff at the hotel have now been contacted. Now to our 2,159 that I talked about yesterday. Again, I'd like to start by reminding anyone who will be in the country now, who was in a managed isolation between June the 9th and June the 16th, who hasn't yet been contacted, or I should say returned a call from Healthline, because everybody has had multiple attempts to contact them, please do so. And we need people to fulfil their part of this process as well. So the 2,159. There are now 1,184 who have been contacted and have tested negative for COVID-19. 800 of those, as I said yesterday, are people who we know were tested before they left managed isolation, and the remaining 384 now were tested after departure. 143 people have also been referred for a test, and we're awaiting results on them. We're still in the process of connecting with the balance, which is 695 people. As needed, we will refer people who we do not make contact with to finding services, reminding you that they get a text first and then a number of phone calls. So it's very clear who the calls are coming from, and we are very keen that those people actually pick up the call, and if they haven't had a call, that they take the initiative and phone Healthline. 168 of those people, that was of the 695, had invalid numbers, so we're referring those people to finding services. This is where we use the customs and police databases to locate them. We've got 137 people who will not be tested because of reasons such as being a young child. They're part of a repositioning crew for a ship. They're currently now overseas, or some are refusing a test. And the number of people who've refused testing is 68. So that's the end of my opening comments, and I'm now happy to take questions.
Dr Bloomfield, obviously those 3 new positive cases had to be transferred, particularly with the case of people who had to be transferred via plane. Are you confident that that happened safely?
You mean they were transferred since they've been...
From Auckland to Christchurch?
Oh yes, so there was the flight that came in from Australia actually, that was then the entire passenger list from that plane was diverted down to Christchurch after they had been processed internationally. Yes, very safe protocols followed for that transfer down to Christchurch. Of course, everybody from who was on the flight is in managed isolation down in Christchurch, so they will receive the day 3 and day 12 testing.
Do the crew on those flights have to isolate now, and if not, why not?
That will be up to the public health unit. I don't have any, I trust the medical officers of health who will be doing a thorough look at anyone who may have had contact. Of course, on a flight like that, they will be taking appropriate PPE precautions, but we'll take a look at that as part of appropriate contact tracing.
The new case definition, does that mean that it'll be harder to get tests because it's already people lining up for hours
yes.
of training?
Yeah, so it won't be harder to get testing because actually we've talked with the DHBs about making sure testing is available for people that need it. What it will do is ensure that the people who are being tested who may be at higher risk are managed appropriately, and those who are being tested because clinicians believe they need testing as part of our broader, and I called it in the last couple of days like supercharged sentinel testing, those who are tested but who really are at low risk don't necessarily need to self-isolate while we're waiting for the result of those tests.
So the claims that we're winding testing down are wrong?
No, actually, well, yes, they are wrong. We actually have gone back to the DHBs in the last 2 days to say, look, actually, we need you to be able to have either CBAC capacity available or make sure your general practices are able to deal with volumes of testing. And we have seen very high volumes in the last couple of days. I think people have been concerned about these latest cases. What I can reassure them, of course, is that all the cases we have reported since the 16th are due to recent arrival from overseas.
So if we're running out of swabs, do we have enough?
We have good supplies of swabs.
So just on that, so it's if you have a cold or a flu or a sore throat, you won't have to be tested now. You might be tested.
You won't necessarily require a test, and the advice, and you'll have heard me say it for some weeks, even months now, is to seek advice from Healthline or your GP about getting a test. And of course, as we come into winter, there will be an increase of people who have respiratory symptoms. Clinicians will be best placed to determine whether or not they require a test. We are still expecting and want to see quite wide testing, because that will be an important part of what I again call our wide community sentinel testing, and that is part of our ongoing surveillance.
Did you bring this decision forward on the case definition? Because it probably always was going to happen that this would change. But did you bring it forward as a result of the rush on demand that the testing centres and GPs have seen?
No, not at all actually. It's been work in progress for some weeks, and we've been wanting to just get everything lined up before we actually put it in place. So primary care have been, primary care practitioners, and you may have seen this in some of their feedback today, have been concerned about the impact of the winter coming on. So we've been working very closely with them to help with a case definition that helps them identify those who are at higher risk and therefore require slightly different management from those who are at lower risk but still may require testing.
Has something changed in the last 2 days? Because a couple of days ago the Minister was saying that there would still be a very low bar to meet testing, implying that the current regime would continue.
Well, the bar is if you have respiratory symptoms, and if you look at the symptoms that are in the list under the case definition, it's very broad. It includes what we call it in medicine coryza, so runny nose, sore throat, cough, cold symptoms. People are not required to have a fever and or a cough, so there is still a wide group of symptoms, but then as has consistently applied, the clinical judgment will be applied, and people should seek advice from Healthline and from their GP about getting a test.
Okay, but the connection to travel was expressly stated in the Health Minister's response. You won't have to have a connection to travel. That was 2 days.
To be tested.
Yeah, that was 2 days ago. Now you feasibly have to have a connection to travel.
No, so just again distinguishing between the case definition and how. So we no longer have the suspected case definition. If you look at the case definition, it talks about those who may be at higher risk, and so therefore the managing clinician is advising them to stay in isolation until they have the test result and to notify the medical officer of health. But they won't need to notify the medical officer of health about others who will be being tested who do not fulfil any of those higher risk criteria. That is, for example, the link to international travel.
So when did you notify the Health Minister that this case definition and testing criteria will change? Because we were hearing one thing 2 days ago and now we're hearing another thing.
Yeah, there's no dissonance between what the Minister has been saying 2 days ago and this, and we've been working with the Minister and in fact both advice from our epidemiologists and clinicians over some weeks, and then communicating with the Minister about it.
The people in the IBIS and Rotorua yesterday found out about that case via the media, and obviously they were put into that lockdown. They say there was no communication essentially about exactly what was happening, and even that the staff at the hotel didn't really seem to know what was going on. Are you confident that communication is good enough?
What I'm confident in is that the right protocols were followed to keep everyone safe. Recognising that this facility was only stood up on Saturday. It's the first, the two facilities I think in Rotorua, it's the first time they've been down there. I think what the staff did was appropriate to make sure everyone was kept safe, and then of course they will be refining and improving their protocols, including communication. When we've had cases in the past, it's been clear that usually people find out about them when I do my stand-ups each day. Now with people inside the hotels, when something like this happens, the information gets out. I know the staff there continue to work with the District Health Board on both ensuring people there are kept safe and just refining those communication protocols. This was the first case they had down there, of course.
Are you expecting to see more though, given that they were crammed and taken from a flight with lots of social distancing and masks and crammed into buses right next to each other with no masks, with what turns out to be now a positive case on one of those buses?
Look, there may be more. I would expect it's more likely that any cases identified there would be people who were infected overseas, but obviously they are there for the full duration, the 14 days, which is why we keep everybody in that 14-day isolation. I should say, and just a comment, I was reading something this morning that just again for comparison, New Zealand has already got a really strict regime at the border. Australia is now starting to, has the 14 days managed isolation. It's now starting to look at whether in fact they start testing people at day 3 and around day 12 of their stay as well. I think off the back of the fact that New Zealand has introduced this.
Well, Marcus, how you felt yesterday standing next to the Minister when he laid all of the blame to the
Oh, well, fine, I don't have any comment to make about that.
Is it hard to take that from the Minister when he's made so many mistakes?
Look, I continue to work really closely with and support the Minister in his work.
A lot of people in New Zealand are feeling quite sorry for you after seeing that footage. Do you have a message for them?
Well, I just remain focused on, as I have since the start of this, doing the best possible job I can, and we continue to remain focused on keeping New Zealanders safe. And I just want to give a shout out to my team who are working incredibly hard to continue doing that, and we'll keep supporting the Minister and all New Zealanders to keep them safe from COVID-19.
How would
Do you
you?
think, given that the Air Commodore has supposedly been in charge of a lot of managed isolation for the past 4 weeks, that you've been unfairly blamed for things that actually happened under his watch?
Oh, no, I don't, because I think that the issue that happened around the testing, which is what I'm taking responsibility for, and we're now sorting out, as I said we would, It was mine to stand up and be counted about, and I have and continue to work really closely with Air Commodore Webb, and we see this as a collective effort. We're both committed to and focused on doing the best for New Zealand and New Zealanders.
How would you categorise your relationship with David Clark at the moment?
Very good.
Can I ask you questions about the Alan Clark report that was released yesterday into contact tracing? It said that there were significant issues with how clusters were identified within the system. Does that remain a risk?
It doesn't remain a risk because we now have a person who leads on all clusters in our team here. We've had that in place for about 4 weeks, and one of the issues I think for the public health units was, and this was raised in the reports, was they would send in information into our National Close Contact Service, but they weren't necessarily getting information back about what was happening that would help them with identifying, that would help them with identifying and managing clusters. Now with our national contact tracing solution, which 11 of 12 units are using and the other one is getting started on using, that will support the information flows both ways, and it's worked very well over the last week.
You've got that prison here, but the report also said that the ministry didn't have total oversight of the whole system. Does that still remain to be the case?
No, that's not the case anymore. Remembering that the groundwork was done with those public health units between the 20th and 24th of April, and so there's been a huge amount of work since then, and if I reflect, some of those recommendations are also congruent with what Dr Varel found in her report. So of the recommendations in her report, all of those are now implemented, bar one that will be tidied up by the end of this week. So we've made huge progress, and I think it's serving us well as we start to get these cases coming through the border.
And just a point of clarification, I know it's been a long time since that report was written, but it did say that the PHUs wanted a nationalised technology solution for both case management and contact tracing. Why does the software you speak about, why doesn't that fill that need?
In fact, it does.
Why did the report say that then?
Because it was at a point in time before we had finished developing and rolling out the contact tracing solution. That was rolled out through May and into June. So the report groundwork was done in third week of April. So that's now in place. And in fact, before we had the cases last week, one of the 3 public health units that was not using that solution was our local one here, Regional Public Health. In fact, they have used it and found it very helpful. So it's really good that we've been able to use it, and that it's been useful not just for us but for the whole system, for our public health units as well.
Is there a deadline for when you want all public health units using the system?
Well, actually, we've got 11 of 12, and Auckland Regional Public Health is staff are being trained at the moment. So recalling here that we had to go and have a training program in place for the public health unit staff to ensure they knew how to use the system. So that's happening at the moment. Not very long at all. But in the meantime, that their system and the national solution can exchange information in both directions.
Are we looking at different procedures for people arriving from more higher risk COVID countries? And if so, what are they?
We're using the same procedures at the moment. So regardless of where people are coming from.
Why are we not using different ones for people from higher risk countries?
Because what most people who come into New Zealand at the moment are coming in from flights from Australia, and they are transiting from places all around the world. There are some who are just originating in Australia and coming, but they are effectively all coming in on those flights from Australia. So we treat them all the same. So everybody is treated as if they could be at risk of having COVID-19. Hence, they all go into the 14 days managed isolation.
Before somebody gets on one of those flights, do you know every single person that's going to be on one of these flights? And are you able to start this process of getting NHI numbers and stuff before they land?
We don't know, and in fact, this is just a feature of borders anywhere, is in fact we don't know exactly who is on the flights until the door closes, and then they have to actually be here on shore and through customs before we can legally start to do the matching around the NHI. So that's something, of course, we're working with border agencies on, but I'm just really pleased to see that we've been able to bring that NHI matching forward to as soon as we can in the process.
There have been a few cases where you've had multiple cases from the same flight, and it's unclear whether they were caught on the flight or caught in different countries. Is something like genome sequencing being used to help figure out whether the origins of those mutations of flags?
Not yet, but we will be able to, because we know ESR has got that capability to do that. But in the first instance, what we'll be looking at, of course, is the seat numbers that people were in, recognising that all the most recent cases have been detected early on at that day 3 testing. So it strongly suggests they were already incubating the virus and may have been pre-symptomatic by the time they travelled into New Zealand, rather than having it been transmitted and them having caught it on the plane. Or it could have been, at some point during their journey. For example, those coming out of Pakistan are going Pakistan, Doha, an Australian port, and then on.
With primary care doctors saying that they're sort of concerned about their resource usage given the high volumes of COVID-19 tests, is something like sewage testing a viable alternative or supplement to sentinel testing?
It's a very useful supplement, and we'll make our surveillance approach document available shortly, and you'll see in there that that includes not just the testing, the widespread community testing, but it does include the use of the sewage or the wastewater testing, and of course our health stat and other influenza-like illness monitoring through the app as well.
The people that you are chasing up who weren't tested and who say they've subsequently been tested, do they need to prove that, or can they just say I got tested and I was negative?
Well, we are wanting to cross-match them with our database, and so there are some there are one or two, I don't know now, but there are one or two who have said they've been tested, but we couldn't find a test result, so we keep following them up to verify that.
I don't know if you've seen this, but there's a bit of a fundraiser going on, like to buy some flowers after how you're treating this today. Have you received any flowers or would you like to?
I haven't received any flowers. I'd love if people have money they wish to put to a good cause that they donate it to a local charity.
In terms of the transfers, do you think that people should be made to wear masks? Because obviously a lot of the transfers between Auckland and Rotorua, between Auckland and Christchurch are going to be happening a lot more.
Yeah, I think that's something we'll look at very closely
Can
and
you
are
commit
looking
to
at.
it,
I can commit to looking at it, and I'll come back to you on it as to what our work suggests we should do.
And in terms of the aircrew on the transfer flights, I know you said public health was looking into it, but do you personally think that those people should be isolating, especially if they've been in confined space with a positive case?
Well, that's what we did with the flights that came from Australia, where we've subsequently identified aircrew who are here. We've isolated them and they've been tested. Yeah. So.
There was a recovery in the last day. Is that right? The data seems the
yes.
Data, yeah.
Yeah.
What can you tell us about that recovery?
Oh, so the two recoveries this week are the 2 women who travelled from the UK who who are considered recovered because they meet the definition of at least 10 days since onset of symptoms, or if they have not had symptoms since their positive test result, and at least 48 hours symptom free. So they're classified as recovered.
Are they still self-isolating though?
Not if they don't need to if they've been classified as recovered, because they are no longer infectious.
Is there any work going on to sort of trace back where the people were infected in their workplaces, so like healthcare workers or supermarket workers, of where their infections came from, so that you can then learn from what went wrong there?
Yes, actually we were doing a thorough piece of work around those people from healthcare settings who had been infected. So can I follow up on that and come back on that and give you an update in subsequent days?
Do you have any indication of when compassionate exemptions might be able to be rolled out again for people?
I don't have an indication, but we are actively working on what would need to be in place to be able to reopen that and assure ministers that we were in a position to reopen that process safely. So that work's underway. I can't give an indication of when that might be.
What do you think would have to be in place for that?
Well, obviously we want to make sure that they present at a very low risk to the community. So I think that will include a mix of a minimum period in self-isolation and a negative test, and a high level of confidence about and assurance about any self-isolation arrangements if they were leaving managed isolation before the full 14-day period.
Have you had a chance to review the proposal for a COVID card, and what are your thoughts on it?
Look, I haven't personally reviewed the proposal, so this is a sort of a Bluetooth type card that would assist with contact tracing. What I can say is that the more I see from countries that have used a Bluetooth type technology, whether it's a mobile phone one or a separate one, it's not straightforward, and I was reading something yesterday that in France, I think it's sort of like 30 people who have been tracked through the use of their mobile phone Bluetooth type app that they've rolled out there, and it's quite a large country. So it clearly, even a card and I would say a mobile app Bluetooth technology will continue to be a minor part of contact tracing efforts. So hence our very big focus on our public health units and national contact tracing. A couple more questions, Barry?
Do you have any updated numbers on the NZ COVID Tracer app?
Well, look, I haven't got those today. We'll include them in the release that we put out, if I can.
We discussed yesterday delays in test results and community testing. Have you been made aware of any more issues with that and what's happening?
I haven't been made aware of issues. I went and talked to the team, and this clearly related to the large volume of testing that was done over the last couple of days. And I know that the labs will be working apace to process the swabs, and also I think there was a particular issue with Hawke's Bay that any additional volumes, recalling that Hawke's Bay I think is the most recent lab to stand up testing, and prior to that their swabs were all going down to Canterbury anyway, so we can move volumes around as we need to.
Have the labs become overwhelmed?
I haven't had any reports they've been coming overwhelmed. We've known for some weeks that they've got capacity to do over 12,000 tests a day if required, so I think they're ready for doing the volumes that are required, and the last couple of days we've needed a fair bit of that capacity.
Just on the testing of border workers and airline crew that was announced a couple of days ago, do you have any more detail on how regularly these people will be tested, how that's going to work?
Yeah, that's being worked up at the moment. The point here is, and we've talked with them all, with the relevant unions and organisations about and I've written to them about the introduction of the testing. We're now working out exactly these issues, frequency, how they won't all need to be tested because it's surveillance, so what the nature of that testing will be. So as soon as we've got that work, and we'll get expert advice on what would be best in terms of sampling and also frequency, we'll let you know.
How far away do you think it will be?
I will be wanting to start that in the next week or so.
Is the Minister
Week or two, I should say.
Has the Minister of Health apologised to you?
No. Right, thank you very much.
Thank you.
Is that a no comment or no?
Why don't we all get together and buy him flowers? You're not on.